Well, one of the things that you'll be doing is you'll be going through diabetic education. So you'll learn for yourself what you need to be looking for and how to monitor your disease state. The glucose meters have evolved quite a bit, even to the point of getting close to having fairly useful continuous glucose monitoring devices available. And that's maybe more useful in a type 1 diabetic, but probably also has a role in certain type 2 or adult onset diabetics. Beyond the monitoring aspects, you have all sorts of new classes of drugs available. Generally, the first step is a drug called metformin, and that is a tissue sensitizer drug that is fairly effective. It has a relatively short window of effectiveness. It's about 36 months on average, but it does have some fade. In conjunction with something called a dipeptidyl peptidase 4 inhibitor, or a DPP4 inhibitor, that drug class is the one that allows a substance to build that protects the kidney and may allow it to be preserved for a much longer time period. There's also a new class of injectable drugs that give you the substance that other DPP4 class blocks the breakdown of, and those are called GLP-1 substances. Two drugs in that class that are also quite good at allowing you to not only regulate your glucoses, but may even help with weight loss. Another drug class is the sulfonylureas. I tend to use those much less frequently. From an insurance perspective, they had historically been viewed as very popular because they're generic and very cheap. But I think even the insurance companies are falling into that idea that the more you can preserve pancreatic function and delay use of other treatments, that it's probably less expensive, and certainly it's less complicating to that individual as far as things like eye damage, kidney damage, and all those other factors.